Mass and Sacraments during COVID-19. On March 6th of this year, one of my partners on the Doctor podcast and radio show, Dr. Andrew Mullally in the middle there, said, one of my patients asked today, Tom, when are we going to do a show on coronavirus? And I thought, you know what? That ship has sailed. It's already a lost opportunity because by March 6th, this is old news. Nevertheless, on March 7th, we got together with our friend Dr. Paul Carson, an infectious disease specialist, recorded a show that we put up on podcast on Sunday, March 8th. And lo and behold, it became the most listened to episode of the 167 we've done to date. On March 17th, little did I know that this sign would go up on our parishes. Churches closed. And throughout the country, the last public masses were celebrated on March 19th, Feast of St. Joseph. And after that, there just wasn't public mass. We resorted to the television mass in our favorite church in the country, the Crypt Church beneath the Basilica of the Immaculate Conception in Washington, D.C. Well, also in Washington, D.C., the Department of Homeland Security came up with a list of essential workers and services. But essential for what? Essential for the human body? Maybe. Yeah, the list does a pretty good job of taking care of the needs of the body. But on this list was not religious worship. No, we were deemed non-essential when concerned with worship. On that same list, yeah, movie theaters, gyms, salons, shopping malls, things that I often associated with church. Actually, no, I didn't. But if we say essential for what, and the what is the human person and not just the human body, then we realize that as human persons, we are not disembodied spirits because the sacraments require a physical presence, often physical touch, and physical objects like bread, wine, water, and oil. So church is essential. Now, early in the pandemic, Governor Andrew Cuomo said, if everything we do saves just one life, I'll be happy. Is that the way we make decisions? If that's true, then why don't we have a national 5-mile-an-hour speed limit? It would save a lot of lives. No, that's not the way we make decisions. And we had to come up with a way to make decisions to have the sacraments and have them safely. And Dominic Legg, a priest of the Dominican order and the director of the Thomistic Institute, was asked, along with his friend, Dr. Deacon Tim Flanagan, an infectious disease specialist from Rhode Island, how can we safely bring the sacraments into the homes of people and into the hospital rooms of those who are suffering? Thus was born the Thomistic Institute Working Group for Spiritual Care in a Time of Pandemic. And that was brought to their attentions at the request of bishops. And so infectious disease experts, medical professionals, scientists, and Catholic theologians had developed guidance for the sacraments. I got to play in this infectious disease sandbox because once upon a time, I worked at the U.S. Army Medical Research Institute of Infectious Disease. And so with this august group of experts, we want you to know that Mass and the sacraments are essential, that they can be administered and held safely using the guidelines of the CDC and more specifically state departments of health, because that's where the legal authority lies. So we've seen very creative ways to have confession. This is a beautiful thing. Currently, the confessional at our cathedral is like this picture. It is not this picture, where there's a heavy curtain in the doorway of our confessional. The priest stands on one side, we stand on the other. A lot of people are directing a lot of frustration, anger, prayers to the bishops. Our bishops need our support. We need to cut them some slack. They are getting it from so many different directions. And so we have provided for them guidelines that they can tailor for their own dioceses. We do not attempt to step on anybody locally, but we intend to provide guidelines that can be adapted so that when Mass did resume, we had a plan to prevent what just happened at this church in Oregon at Lighthouse Pentecostal Church. In mid-June, they had a Sunday where they had no social distancing, no masks, and lots of singing. And guess what? 236 of the 365 people that showed up came down with coronavirus within the next 2 weeks. And remember, coronavirus is much worse than the flu, 12 to 39 times worse. That's the risk of dying if you get coronavirus instead of flu. It's 12 to 30 times more. And there are excess deaths going on. This is a graph of excess deaths over the last several years. You see at the far right end, all those red crosses, that shows that there are more deaths in the United States than we would predict by chance alone. And what's it due to? COVID. And perhaps even COVID side effects from the unintended consequences. Now we know that nobody wants to infect someone else. So to avoid that, please, out of charity, stay home if you have any of these symptoms. And yes, the symptoms keep increasing. Now you cannot tell the flu from COVID by symptoms alone. Only a test can do that. Stay home if you're high risk, like people who live in nursing homes, because age is a high risk category, as is serious heart disease, kidney disease, obstructive pulmonary disease, diabetes, obesity. So these people, like my father, who some of us are visiting here, we have to visit through the window right now. Each with a phone in, we can at least see him. So for safely having masks, 3 W's: watch your distance, wash your hands, wear your mask. How much distance should you wash? Is this enough distance? Yes, it is. We use 6 feet. There's nothing magical about 6 feet, which is about the distance between 2 rows of pews. But we do know that larger droplets that we exhale or cough or sneeze out typically fall to the ground in about 1.5 meters or 5 feet. Yes, some lighter particles do float through the air further. These carry far less viral particles and right now are not thought to be a primary or source of getting coronavirus. It's possible, but far less likely. As an example, here is an example of Petri dishes which grow bacteria that were held at 2, 4, and 6 foot distances from this man. And this man wore a mask and then did not wear a mask. And he coughed for 15 seconds. And each of those little dots on the mask row is another colony of bacteria growing. Now, the medium will not grow viruses, but this shows what would happen with viruses also. And you notice as you get out to 6 feet, far less grow. And if you wear a mask, nothing grows. Wash your hands. How long? 20 seconds with soap and water, about the length of saying an Our Father. You can also have that nice raspy tongue of a cat lick you clean. Actually, that's not approved. But one that is approved is using hand sanitizer with at least 60% alcohol and rubbed in until your hands are dry. Now, if loving your neighbor at Mass includes washing your hands, it also includes wearing your mask. Now, there are some major exceptions, and those are the people who are exercising in office up front, particularly the priest acting in persona Christi. Wearing a mask when he's acting in persona Christi would suggest that Christ can either infect us or be infected by us. Not true. But this is no different than our public officials when they were talking to us during the lockdown. They took their masks off when they were addressing us and put them on afterwards. Now, the cloth mask or surgical mask acts as source control. It prevents particles from coming out of you and infecting others. That's the main way it works. Yes, it does protect you a little bit from others, but it primarily protects others from you. Just like if you go in a doctor's office, any winter of winters past, if people were coughing, they were asked to put on a mask. Same way we need to do it. The problem is at least half the people with coronavirus don't have symptoms. So they are shedding virus into the environment without realizing it. That's why masks are so important. Here's another example of what happens with going from top to bottom: a sneeze, a minute of singing, a minute of talking, or 2 coughs. No mask versus a mask held 1 foot away. Look at, if the mask is worn, nothing gets through with the singing, the talking, the sneezing, or the coughing. And more evidence is accumulating that wearing the cloth face coverings, wearing the mask, prevents transmitting. I believe that if everyone wore a mask in public, that this pandemic would come to an end relatively quickly. But that's just me. So other example, if we look on the top and the bottom rows here, we see a cloth mask and we see a cone-shaped mask. And with coughing, what happens? Where those green light is, a little bit gets out at the top and maybe the bottom, but it's not expelled in front where other people could be. As an example of this, a coughing man from Canada got on a plane to return home from China on January 22nd. He was on a 15-hour flight with 350 passengers. It was found out days later he had COVID, but he wore a mask the entire trip, coughing the entire way. Out of the 25 people within 6 feet and the 350 on the plane, exactly 0 of them tested positive for COVID. Masks work as source control. Our Surgeon General on the 4th of July said wearing a mask means freedom. And I agree with that. It means freedom to do more of the things that we want to do. In early April, the New York Times published a good article on how not to wear a mask. And I've seen this so much. Not on the nose. 90% of your air exchange at Mass is probably through your nose. Don't do this. Don't just barely put it up above the nose because there's still a lot that's getting out. This is on a ferry boat from Mackinac Island last week with some of my family. They're all wearing masks. These 2 guys to the side, they're rocking it at about the level of their mustache. It doesn't help. And also, you need to cover the chin. You need to cover the mouth and nose. What you should do is tightly cover the nose and make sure you press down around it so minimal air, if any, can get through under your eyes. Okay, that was masks. What about the 3 C's? We had the 3 W's, the 3 C's of communion, cantors, and consistency. Communion. We know that saliva carries virus in someone who's infected at the same level as their nasal secretions. Therefore, it is more risky for the priest and for other communicants if the priest touches the tongue of someone infected. We know that it's less risky if you receive in the hand, but our guidelines do not say that you must only receive in the hand. At our parish, we have a priest that has some pre-existing conditions. So one of the men there made this plexiglass shield that he stands behind to distribute communion in the hand or on the tongue of those who kneel to receive it. The second C, cantors, and along with that, singing. We all would love to have singing at Mass again. Can we do it safely? What should we do? In the guidelines, we say that singing in choirs or as a congregation right now should be discouraged. Yeah, that's the word. Why? Because just saying ah for 30 seconds produces twice as many particles as continuous coughing. On March 8th, the Amsterdam Mixed Choir performed the Passion of the St. John Passion by Bach. Days later, 102 out of 130 members tested positive, and none of the members had symptoms the day of the concert. At Mount Vernon Presbyterian Church on March 10th, in Washington, the Skagit Valley Chorale had a rehearsal with 61 people practicing social distancing, not touching, not sharing music, not shaking hands. 53 out of 61 came down with disease. None of them had symptoms there. 2 of them ended up dying. On March 14th, Berlin Cathedral Choir performed. 2 weeks later, 30 of them positive, 30 more had symptoms. On May 5th, the leaders of these many choral groups across the country said that they will not gather again to sing in person until a vaccine or treatment for COVID-19 becomes widely available, even if it takes years. It doesn't mean we can't have music at Mass. We can have organ music. We can have most, instrumental music, piano. We can also have cantors if they are a significant distance away from parishioners, or if they're singing in a different direction away from or perpendicular to where parishioners are sitting, or if they have a barrier in front of them, like this cantor at a funeral I recently attended, or like this church in North Dakota with a saran wrap in front of the cantor who has a microphone, or plexiglass as is present in our cathedral in Fort Wayne. And the final C, consistency. The New York Times said that the church was a dangerous place to go, and all the churches they talked about were not following guidelines like we've developed. And in the article, they talk about 650 or more cases spread through churches. This really seems inconsequential when there have been 3.5 million cases in the United States. And then there's Nevada, where gaming operations resumed in early June with 50% occupancy limit. 2 weeks later, big spike in cases. Yet, despite several attempts through judges, the churches there do not get a 50% limit. They get a 50 limit, 50 people, no matter the size of the building. And in San Francisco now, Mass is allowed only outside with up to 12 people. Yes, it's not fair. And I can't think of a national group besides the church that's doing such a safe job with holding events. So you might ask, what should I do? What can we do together? Well, on our working group, we think that we should continue to be vocal, courteous, and persistent in contacting mayors, council members on the county or city or even more local level, maybe governors and legislators, because we want equal application of public health rules. The same for bars, restaurants, casinos, and for masks, because it's all about density, wearing masks, and distance. It's not about what the event is that makes it safe. And in fact, our event is more safe because we're all facing the same direction. We're not talking to or at each other. But we should continue to have masks under whatever conditions. Even if it's only 10 people, they should meet, because the mass has incredible consequences. And during the prayers of the faithful, pray for healthcare workers, first responders, public health officials, decision makers in the end of the pandemic. How long, oh Lord, will this last? I don't know. But something I do know is that I rejoiced when I heard them say, let us go to the house of the Lord. The bottom line, church is essential. It can be done safely if you watch your distance, wash your hands, wear your mask, and exercise prudence so our masses don't become means of spreading infections. This will continue indefinitely, but while it does, we can continue to attend the celebration of Mass and receive our Lord in communion, and that we must never take for granted.